Hi, in previous episodes we told which materials is used for direct making temporary crowns. In this video we will talk about the features of their manufacture. In this case, old metal ceramic crowns have to be removed, the fit of which leaves much to be desired. Perhaps the doctors still believe that the dental technician is a fairy. See our issues about Hogwarts. Such a fit was one of the reasons for such a sad state of periodontium. First of all, we take the impression by the putty mass of silicon C. This will be economically profitable. Impression of existing crowns will serve as a key for making temporary crowns. Proceed to the removal of metal ceramic crowns. More information about the methods and tools for removing crowns will be discussed in one of the next episodes. And now we turn to making temporary crowns. If the crowns were made with a poor fit and placed under the gum level, we recommended to install retraction cords, as this will prevent unavoidable bleeding and allows you to make temporary crowns with a good fit. After removing the cement residues and correcting the shape of the preparation, you can start making temporary crowns. For this purpose, it's necessary to prepare the impression made earlier. In the cervical area, we cut a little part of silicone, so that the material of the temporary crowns flows a little on the gum. This will allow us to make the correct contours of the crown. This technique prevents thinning of the crown in the cervical area, because often the preparation margin remains outside of the old crown borders. It's advisable to cut the interdental septum from the oral side. This will not bring discomfort to the patient, but will enhance temporary crowns. When making temporary bridges in the distal section, we recommend to do it from the vestibular or oral side. This is one of the most effective and cheap method to make the temporary bridges stronger. For convenience of positioning the K impression, we recommend to mark the projection between the central incisor and canines with a marker or scalpel on its vestibular surface. Then fill the prepared K impression with composite material. We recommend to keep the tip of cannula on the bottom of the impression and move it while filling. This minimizes the formation of pores on the occlusal surface or the cutting edge. At this time, the assistant dries the teeth. After position of the impression completed, just wait according to the instructions. It's important to comply with the time mode, because after overexposure temporary restoration will be extremely difficult to remove, and under said condition will lead to deformation, and that all will lead to rework. But who wants to waste materials and cannulas and remove the inhibited layer from the surface of the impression? If this ignored, then the surface of the temporary restoration will be with stains and hard to polish surface. We remove the impression from the oral cavity and waiting more, letting the material to gain strength. There are several ways to extract temporary crowns from the impression. The most unsafe is to try to hook the bridge. You can push out restoration with a tool from the backside of the impression, or carefully turn off the impression from the tray and remove temporary crowns by pushing the edges of the silicone mass. Therefore, the use of an adhesive for silicone is not recommended. For beginners, we recommend to make two impressions. After removal of the temporary crown, provide a little treat. Remove excess weight, create some space inside the crown for relining. Be sure to fit the design in the mouth and proceed to the relining. If you saw our two previous episodes about the temporary crowns, then you understand the relining can be done in two ways. With flowable light curing composite, it is reasonable when 1-2 units with the same material for temporary crowns. With a large number of units is more convenient and faster way. We put the material inside the crown, press on the teeth. The presence of the cord during subgingival preparation allows to reline at the first time. Wait and extract for processing. An important point: the cord allows the material to reach the edge of the preparation, but the gum usually hangs a little. This creates a concave contour on the crown. Therefore, before proceeding with processing, it's necessary to identify such places and add a liquid composite. This will allow to form the correct gingival contour, and of course to create comfortable conditions for making an impression. Now we proceed to the treatment of crowns with discs. Coarsely remove excesses of material and create space for the interdental papillae. For this you can also use a separating disc. Then apply polishing discs. To give the restoration final shine, you can use a fluffy buff and glazing fluid. The floss put on the restoration in this way will help to remove the excess cement after fixation. Check the fit and occlusion. Temporary crowns are finished. Thank you all for watching. Do not forget to subscribe to the channel. Write your comments. Watch us every second Monday. Bye.